My name is Elizabeth Lawrence and I'm Director of Care and Comfort Community Services. Care and Comfort is a registered charity. I set it up in 2007 responding to a need for services for older people in the Newark and Sherwood area. There was very little for older people in Newark and Sherwood. A lot of the larger organisations and registered charities didn't want to come out to the rural areas. And considering that Newark and Sherwood has the highest numbers of older people in the county, there was obviously a need for services to keep people independent at home. Care and Comfort have helped individuals to meet their outcomes, and one gentleman in particular, he'd spent most of his life sort of breeding dogs, and in the latter years he'd been looking after his wife, who unfortunately went into a care home and then passed away. Unfortunately, very shortly afterwards he had a heart attack and a stroke, and he was referred to us by social services. When we initially went to see him, it was quite clear that really what he wanted was to make a life for himself, not really be stuck at home. He'd been quite an active man, obviously walking his dogs, and one thing we found out that he used to like to do was cycle. He had a cycle in the shed, and our male support worker went along, took his own bike and went along, mended this client's bike, the service user's bike, and they started going simple places, really, places where there wasn't any traffic to try and build his confidence. And then they took the bike into Newark and went down the towpath. And then he was taken on the road, just very short distances to start with. And then obviously they became longer and longer distances. So that wasn't just about his mental health and well-being, that was also about his physical health and well-being, and enabling him to lead an independent life again. There's a chair-based exercise group here in Farnsfield. Obviously it's very good for their health and well-being, releases endorphins, it gives you a real good feel-good factor. They actually also come for the little social afterwards. Our volunteers have the opportunity to attend the same training sessions as the paid workers. Most of our volunteers are on the befriending side of the service, so they actually visit people whose mobility is poor and really they are housebound. But our oldest volunteer is 90. He actually visits 3 people younger than himself. He's a really great chap, and he does enjoy what he does. We do have a telephone support service, and quite often it's used for prompting things like, have you taken your medication this morning, or just a phone call for somebody who is alone, can't get out, sometimes doesn't even want to go out, but really needs to chat to somebody. But the telephone support service is only used really for those people who don't want to visit or feel they need to maintain some sort of contact with somebody. So at Care and Comfort, we are not task orientated, we're person centred. It's around delivering the services for the client, for the service user, and ensuring that we talk to them and enable them to obtain their own outcomes, and we will work with them to achieve that.